All right, so vaccination for children aged between 12 and 17 began today. Though parental consent is not required under the Child Act, it is recommended that a parent or adult accompany the kids to get the jab. We've been visiting some of the vaccination sites in Johannesburg and Cape Town today to see how many kids are lining up. We're joined by our reporter Heidi Giokos in Johannesburg and Nobesthu Hajana in Cape Town, who've been keeping an eye on this story on the ground all day. Hello to both of you. Nobesthu, I'll start with you in Cape Town. So for the first day, 12-year-olds and up could line up. Talk to me about the levels of excitement, nervousness, what kids were saying to you.
They were very excited and nervous at the same time, but they knew exactly what the vaccine is all about. In fact, I spoke to a 13-year-old who was telling me that because he knows what this has done to a number of people dying from COVID-related illnesses, so he wanted to take precaution, and he says it's a decision that he took for himself. Obviously, their parents were there to help them through the process, but at the Athlone vaccination site, the drive-through was the most popular one for the kids, and some of them were actually lining up inside, but this is what they had to say about the experience and also what they were looking forward to get their first jabs.
So why did you decide to get the jab?
I just don't want COVID, and it's better than not taking it.
Just to be cautious and not to because I'm not to get it because I'm sick, man. I have allergies and stuff, so just to be cautious and stuff.
So, Nobesthu, those are the children who lined up for their jabs today. Talk to me about the department. Was it all systems go? Were there any glitches to introduce this new group to vaccinations? And what was the turnout like?
Well, certainly everything was in order. In fact, when I spoke to Monique Johnston from the Department of Health earlier on, he was quite nervous about the turnout because we understand it's Wednesday and many of the children are at school, and the vaccination site there, it closes at 4:30, so they weren't sure if they were going to get quite a number of children turning out, and they were very excited. In fact, later on this morning, this day, at around about 3, she was telling me that they had about 60 children who went for their vaccination, and she was saying that they expect to have more over the weekend, understanding that most children will be at home. And she was also encouraging their parents to make sure that they bring them, and their sisters or nurses inside there, they were going to take through, in fact, counsel them if they are nervous. But this is what she had to say.
Currently, we have seen over 60 children within that age category, 12 to 17, coming for their vaccine. Parents are bringing them directly from school because we're seeing them coming in their school uniform, and they're all excited. The parents are excited as well. And from the department, we are pleased because it's helping us fight COVID-19 and also looking forward to a safer summer.
Okay, so that's the picture from Cape Town. Nobesthu, thanks for that. Heidi, you've, of course, been here in Johannesburg. Talk to me about the level of interest in Johannesburg and generally, what's the sense of the uptake?
Yes, so we do understand, Sally, that as of 12 p.m. today, which is the first day that those aged 12 to 17 can come and get their one Pfizer COVID-19 vaccine, over 30,000 people have registered on EVDS. Now, keeping in mind that not everybody is able to register on EVDS, and not everybody has to register on EVDS if they want to get the COVID-19 vaccine, they can come to a vaccination site and they will be helped. The Department of Health saying that they're quite surprised at the keen interest in this age group. The department says the only reason why they opened up this particular age group from the beginning is because there was a very keen interest and demand from certain people to say that their children are keen to get the vaccine, and this is why they should open it up. When we spoke to the Acting Director General, Dr. Nicholas Crisp, last week, asking him what the target is, he made it very clear that while they want to vaccinate as many people as possible, there isn't a specific target for the age group 12 to 17 years old, because they still want to target the most vulnerable, which is the 60 plus and the 50 plus. So for now, it's whoever wants the vaccine and whoever is in agreement with their family members to get the vaccine, and they are aged between 12 and 17 years old, they can come to a vaccination site and be vaccinated. Let's listen to the Department of Health spokesperson Foster Mohale about this issue.
Indeed, our EVDS has officially opened from 8 o'clock for this age group, 12 to 17 years old. But we know that most of them that are at the school, we didn't anticipate a higher number of them in the morning. We anticipate the higher number of them anytime from after school and also during the weekend. So between 8 o'clock and now, we have managed to register at least about 30,000 of them, and we believe the number will increase as most of them, they come out of the school. They will be going to different vaccination sites with their parents.
Heidi, you've also spoken to some of the teenagers. What have they said to you?
Yes, some of them really excited, others really scared, but once they were vaccinated, they said they didn't even feel it. What was also interesting, Sally, is that we spoke to some of the parents that were with the teenagers who got vaccinated, saying that a lot of them decided to come out of their own. They weren't forced to come to get vaccinated, and the teenagers actually asked their parents if they can come and get vaccinated now that the vaccine rollout includes age group 12 to 17 years old. We also got a chance to speak to two brothers who said that they lost their grandmother in July, and the whole family got COVID-19, and they felt as though because they're so exposed, because they are around so many people every single day, they decided that the best thing to do would be to get vaccinated. It's a 13-year-old brother together with his 17-year-old brother, and we spoke to a number of other people, 12 years old, 13 years old, many of them saying, well, my parents told me to get it, or others saying, even though my parents told me to get it, I wanted to get the vaccine because I want to protect my family members and the most vulnerable in my community and society. So let's listen to a couple of those who got vaccinated today.
I'm grade 10, I'm Amy Fusdale, I'm 16. I decided to get the jab because I'm sick of COVID. It's been a long 2 years and I want to get back to normal, so fight against COVID and just get it over and done with.
I decided to get the vaccine because I want to protect myself and others, because together we can create herd immunity and protect everyone. Because certain people think that the vaccine will kill you or create bad stuff to happen to you, whatever, but I don't think that's true. And I just want to protect myself.
We all must get vaccinated because the COVID is very bad. Many people died, so we all must get.
Yeah, and let's not forget, of course, that children too have been touched by grief and losing loved ones to COVID-19. It's not only about them getting their lives back to normal. It's very often in honour of a loved one lost to COVID. Heidi, this issue of consent has been a real hot potato. We know that the Children's Act says that you don't need the consent from your parents from the age of 12. Interestingly, though, Dr. Nicholas Crisp talking about this and making the point that while we think of family in the traditional sense with a parent or two looking after the child and helping them making very big decisions, there are many child-headed households in this country. There are many children who've lost both parents. But you've also been speaking to parents. What are they talking to you about in terms of this consent issue?
Yes, Sally, many of them saying that they make the rules in the house and the children need to speak to them about whether or not they want the vaccine. But many also saying that the Child Act is there for a reason, and many of 12-year-olds are in a position and mature enough to make a decision when it comes to their medical health and their medical status, and they would rather keep it that way and have 12-year-olds make that decision. So also speaking to the Department of Health earlier on, Sally, about this particular issue, and the Department of Health saying even though a directive has been sent to other departments and to various vaccination sites across the country to say, while it's not mandatory and not necessary, it is recommended that a parent or a guardian comes together with the teenager or those 12 to 17 years old to get the vaccine, just to make sure that they understand what they are doing, to understand what vaccine they are injecting into their body, and just to make sure that they are fully aware of the situation. Many times they are unable to come with parents, or there are child-headed homes where there are no parents. And the department's also speaking about them working very closely with the Department of Basic Education as of next year only to possibly roll the COVID-19 vaccine out at schools, because now it's closer to the end of the academic year. There is no time to roll this out, but they want to make sure that everybody who gets the vaccine is fully aware of what they're getting involved in, and to make sure that they feel comfortable and safe doing so. But the issue of consent, many parents saying, well, it is what it is. If my child wants the vaccine, then they should get it. Where other parents are saying, as much as the Child Act protects them, they still need to ask for my permission, as I am still the parent.
All right, well, thank you very much for those updates. Heidi Giokos in Johannesburg, Nobesthu Hajana in Cape Town.